AI minds, quantum leaps. Cut the noise, dive deep. Truth unlocked. Dr. Mike on the mic. Tech Unfiltered is on the clock. Now it's time for the show.
Your blood sugar may soon become part of an ongoing conversation with an artificial intelligence health coach. On August 11th, 2026, Abbott and Google Health announced a multi-year partnership. Abbott makes Lingo, a small sensor worn on the back of the arm that tracks glucose throughout the day. Google has the Google Health app and its Gemini-powered health coach. Under this partnership, Lingo glucose trends will appear alongside information such as sleep, activity, and recovery. The coach will use that broader picture to offer personalized suggestions about food, movement, sleep, and related habits. Abbott says the integration will continue rolling out later this year. This is a confirmed announcement with same-day independent coverage from drug delivery business and fierce biotech. The important question is what this system can actually tell people and where its limits remain. A continuous glucose monitor is a wearable sensor that estimates glucose in the fluid between the body's cells. It sends frequent readings to an app. Lingo is an over-the-counter version, so an adult can buy it without a prescription. The Food and Drug Administration cleared it for people 18 and older who are not using insulin. Because the sensor measures glucose outside the bloodstream, its graph isn't identical to a laboratory blood test. Readings can lag behind changes in blood glucose, and individual measurements can vary. The value is often in the pattern across time, not in treating every point as an exact statement about the body. Lingo is not a diagnostic device. Abbott says it isn't intended to diagnose a disease, including diabetes. The Food and Drug Administration says a user should not take medical action based on Lingo's output without consulting a qualified healthcare professional. That boundary is central to this story. A wellness sensor and an artificial intelligence wellness coach may feel medical because the advice is personal and it appears beside a measurement from your body. The disclaimer may be clear, but the experience can still feel like a clinical opinion. The underlying public health problem is real. The Centers for Disease Control and Prevention estimates that about 115.2 million American adults have prediabetes. That's more than 2 in 5 adults, and roughly 8 in 10 don't know they have it. Those numbers explain why earlier and more personalized feedback is attractive. They don't prove that this particular system works. A consumer glucose sensor combined with an artificial intelligence coach is not a screening test. It doesn't replace the blood tests and clinical evaluation used to diagnose prediabetes or diabetes. The companies have not shown that wearing Lingo and following automated suggestions will prevent disease. The appealing use case is easy to imagine. A person sleeps poorly, skips breakfast, eats a large late lunch, and sees a different glucose pattern than usual. A coach with access to sleep, activity, and glucose information might connect those events and suggest a small experiment, such as changing meal timing or taking a walk. That can turn abstract advice into something personally observable. But an association in one person's graph cannot prove that one event caused another, and a suggestion that feels personalized can still be wrong. Independent clinicians interviewed by the Associated Press in 2025 said the evidence of benefit is limited for healthy people with normal glucose regulation. They also warned that ordinary fluctuations can be misinterpreted. Experts don't yet agree on an optimal continuous glucose pattern for someone who doesn't have diabetes. More data then isn't automatically more understanding. Glucose normally changes after food, exercise, sleep, and stress. A single rise after a meal isn't a diagnosis or a moral judgment. It may simply be normal physiology. An artificial intelligence coach can still create a clear and persuasive explanation from noisy or incomplete information. That is useful when the pattern is real, but it can also make uncertainty sound more settled than it is. A wrong interpretation may affect what someone eats, how they exercise, or how anxious they feel about their health. The research component may ultimately be the most important part of the partnership. Abbott and Google say they plan one of the largest real-world metabolic health studies to date. They expect to combine continuous glucose readings with wearable information, laboratory results, and surveys. The goal is to identify relationships among activity, sleep, well-being, and metabolic health, then use those findings to improve future coaching and Lingo features. That work hasn't produced results yet. The announcement doesn't provide a participant count, enrollment criteria, a detailed protocol, a control group, final endpoints, or a publication plan. Claims about what the study will accomplish are forecasts, not findings. Its value will depend on the design, the diversity of the participants, the outcomes measured, and whether positive and negative results are published independently. It will also matter what the study calls success. More app engagement or more completed coaching conversations wouldn't necessarily mean better health. Stronger evidence would show durable changes in clinically meaningful measures, useful behavior change without unnecessary anxiety, and benefits that remain after the novelty of a new device has worn off. There is also a privacy question. Think about the information that can come together in this system: glucose, sleep, movement, device information, potentially medical records imported from a healthcare provider, and conversations with the coach. Combined, those sources can describe a person's routines and health in remarkable detail. Google's support documents say medical records imported from a provider aren't used for personalization unless a person turns on the health coach and consents to that processing. Google also says additional sources may require separate permission. In the company's stated design, that use is consent-based. Consent, however, should be understandable and easy to revisit. A user should be able to see which sources are connected, remove one without losing everything, understand how long information is retained, and know what happens when a history or account is deleted. The product becomes more personalized as more sources are connected, so those controls need to remain visible. The service also has real access requirements. Abbott says the health coach requires a Google Health Premium subscription, a compatible device, the app, and an internet connection. Availability varies. Lingo itself is a recurring consumable because sensors need to be replaced. People should consider the complete cost, not only the initial hardware price. The commercial incentives are straightforward. Abbott benefits when more people consider continuous glucose information useful enough to keep buying sensors. Google benefits when its app becomes the place where health information is combined and interpreted. Those incentives don't make the product untrustworthy. They do make clear limits, independent research, and user control especially important. A responsible version of this experience would clearly separate a sensor estimate from an artificial intelligence interpretation. It would avoid treating one glucose change as a verdict. It would state uncertainty, direct concerning patterns or symptoms to qualified care, and make data connections and retention settings easy to inspect. It would also test whether the guidance works across age, sex, race, ethnicity, disability, income, and different baseline health conditions. Those are reasonable standards for evaluating the rollout, not promises Abbott or Google made in this announcement. For users, 5 practical points matter. First, a wellness insight isn't a diagnosis. Second, look for patterns over time instead of reacting to one number. Third, review which devices, apps, and records are connected to the coach. Fourth, understand the subscription, device, internet, and replacement sensor costs before buying. Fifth, follow the study methods and results, not only the launch claims. This partnership shows consumer artificial intelligence moving beyond occasional questions and toward continuous interpretation of personal biological data. That could make guidance more timely and useful. It will also sometimes be confidently wrong. The value will depend on whether the system makes uncertainty visible, respects meaningful consent, and keeps wellness guidance from quietly becoming unverified medical advice. Until next time.